Michigan Cares for more information. And the month of April is Sexual Assault and Domestic Violence Awareness Month. I know that during this time when we're encouraging everyone to stay safe and to stay home, that sometimes home is not the safest place for you to be. The Michigan Sexual Assault Hotline, you can talk, text, or chat with someone at 855-4. And Domestic Violence Hotline, 1-800-799-SAFE, S-A-F-E. They're available whenever you need them. So in the last 48 hours, we've had a number of things happen. Yesterday, I announced that a coalition of Midwestern governors and Kentucky are leading a bipartisan effort to re-engage the economy in the Great Lakes region. This is a partnership between Michigan and Ohio, Indiana, Illinois, Minnesota, Wisconsin, and Kentucky. This is an effort because we all know, we governors understand that COVID-19 does not respect state line or party line for that matter. And this is a bipartisan group of governors coming together because we know that we are connected. It's not just borders we share, but it's industry and it's an economy. So here in the Great Lakes region, we are bound by our waters and our commitment to the people that we serve. Throughout this crisis, I will say that one of the great supports that I've had in terms of having resources is in my fellow governors. We've shared intel, we have shared our thought processes as we've navigated keeping the people of our respective states safe. Our economies, too, are reliant on one another, and we must work together to safely reopen them so that hardworking people can get back to work and business can get back on their feet. We will continue to work with experts in health and medical, the best experts across the country, including our own Dr. Janae Caldoun. We will work with fact-based, data-driven approach to reopening our economy in a way that protects families and workers from the spread of COVID-19. We will closely examine 4 factors in addition to others that we will be developing, but there are 4 that every one of us governors has acknowledged really important to safely re-engaging sectors of our economy. One is the sustained control of the rate of new infections and hospitalizations. 2, the enhanced ability to test for COVID-19 and to trace. 3, sufficient healthcare capacity and so that we can handle resurgence. That means knowing that our hospitals are not in surge mode, but they are capable of taking care of anyone who needs assistance at the hospital and they have the PPE to do so safely. And 4th, observing best practices when it comes to social distancing and mitigating the spread of COVID-19. Now, this doesn't mean that our economy is going to open all at once. It doesn't mean that these states are all going to take the exact same steps at the exact same time. But what this does mean is that we are all now working together to make sure that we are making data-driven decisions and protecting people in our region so that we don't see a second wave of COVID-19. We've also announced a number of new testing sites here in Michigan in a partnership with businesses across the state. Wayne County and the city of Southgate announced the city's first drive-through test site, which opened yesterday. The site will serve people who are exhibiting symptoms of COVID-19 and all healthcare providers and first responders, whether or not they are experiencing symptoms. We want to get more people tested. Testing will require an appointment at that particular spot through Quest's MyQuest online portal and app, and that's the link right there, www.myquestcovidtest.com. And we are working to build more partnerships with our businesses to improve testing. I want to take a moment to encourage anyone who thinks that you need a test for COVID-19, you're experiencing symptoms, to go online to the Michigan website and find out where the closest testing facility is to you. We need to get people tested in Michigan. And I know we've been unable to meet need for a while, and so people aren't as hopeful that they can get a test, but you can get one, and we're encouraging everyone to do that. In order to safely reopen our economy, we've got to know how much COVID-19 is still present in our state. So the more people that get tested, the better. So I'm encouraging you to go online and find out where your local spot is so we can make smart decisions and keep people safe as we move forward. On Wednesday, the MEDC announced that 12 small businesses and nonprofits around Michigan have been awarded a total of $1 million Michigan Business Connect COVID-19 Emergency Access and Retooling Grants Program. This program is providing funding to small manufacturers so that they can retool and produce critical health and human service supplies. With this funding, these businesses will begin to make surgical masks, gowns, medical tents, and more. I want to thank Gardner White Furniture, who has donated their fleet of trucks to COVID relief efforts. They've been partnering with organizations like the Metro Detroit Diaper Bank, Lighthouse, United Way for Southeastern Michigan, the Chaldean Chamber of Commerce, the Oakland Public Schools to collect and transport food and other needed products. I also want to thank Walmart, Salesforce, and State Farm, who have teamed up to donate 500,000 masks, 100,000 gloves, and 50,000 shoe covers to Michigan. With regard to PPE and what we have received, I can just say that yesterday we did receive another 274,000 face shields, 6,000 canisters of sanitizer wipes, 417,000 gloves, 1.8 million surgical masks, and 360 boxes of N95 masks. We are working incredibly hard to make sure that whether it's through production inside our state borders or contracting outside, we are getting the PPE that our frontline needs. And we're hoping to expand so that everyone who's in a business that is exposed to people can have the protection that they need. I've been meeting and will continue to meet regularly with a group of business and labor leaders. I want to be very clear. The decision to re-engage sectors of our economy is going to be based on facts, on science, and on what is the best medical advice that we can get. Right now, the shape of Michigan's epidemic spread curve is still evolving, and social distancing is still crucial. When we start returning to work, we will begin with low-risk sectors. And as a state, we may re-engage our strategy by region, depending on what the data tells us. It is too early to lay out precisely what that will look like, but we are doing the hard work now so that when it is safe to re-engage, we're able to do so in a strategic way. Any return to work will be phased in carefully so that we can track the impact of lifting social distancing measures and what that means for the spread of COVID-19. Our number one priority here is keeping people safe. When we look at workplace risks, I will be examining factors like whether the workers interact with the public, whether the workplace is indoors or outdoors, whether workers are in close proximity to one another, whether workers use shared tools and or machinery, the number of people in a workplace, and more. I'm working closely with health, business, and labor groups to ensure best practices are used when people do return to work. Best practices like new workplace arrangements to enable social distancing, screening of employees and members of the public, available hand washing facilities, PPE, and more. We're not there yet. The rate of infection remains high, especially in certain parts of our state. The threat of a second spike that overloads our hospitals is still very real if we don't get this right. But I promise that I will keep you all informed as we get closer to re-engaging our economy, and I will have more to share on that next week. The vast majority of Michiganders have been doing their part, and I'm grateful for that. You're the reason that we are driving this curve down. The stay-home order has worked because you have made a commitment. It's making a difference. I want to remind everyone that during your time at home, it's crucial that you fill out your census form. What we know is that as we get assistance from the federal government, It is based on how many people live in Michigan. So we all need to make sure that we get counted right now. It's simple and you can complete it online. And for one person, it's 9 questions. If you live with a few others, it'll take you a little bit longer, but it's pretty quick. Completing it is the easiest way to make sure that our federal tax dollars come back into our state when we need them, and we need them. The census count directly impacts the amount of dollars that we get from everything from food assistance to housing to healthcare to roads to COVID-19. And that's why it's important everyone takes the time and gets counted. You can go online, you can fill it out in the mail, you can even do it over the phone. But please get counted now. So, an